So Nina and I are very excited to present on the humerus fracture with radial nerve palsy. Our slideshow is set up to where, as we're speaking, our important highlights are going to be behind us. So for those that are here this morning, you'll be able to follow along and get that full experience. For those at home, we would just recommend you download the PowerPoint and do the same when we're presenting. Case study. To start off the scene.
So we'll be working with Yolanda, who is a 62-year-old female. She fell in her garden and sustained a proximal humeral fracture. Along with this, she sustained radial nerve palsy in her left arm. She's 2 weeks out, and she has a sling, and the doctor has referred her for OT for an eval and treatment.
Hi, good morning, Yolanda.
Hi.
I'm Sue, and I'm going to be your occupational therapist. I'm going to help you with your daily activities.
Great, thanks.
So please have a seat. I reviewed your chart, and I saw that 2 weeks ago you sustained what we call a proximal oblique fracture in your upper arm bone here, your humerus. Can you tell me a little bit about that, how that happened?
Yeah, I was in my garden planting, and I fell on my outstretched arm, and it hurt a lot, so I knew something was wrong.
Yeah. Well, falls are one of the most common reasons for a humerus fracture, as you'll see on this slide. Can you tell me a little bit about how that happened? Did you fall or did you trip over something?
No, I do have type 2 diabetes. My blood sugar was definitely low, and I could feel myself getting dizzy, and that's when I fell.
Okay, well that's good information to know as we continue with our treatment, so thanks for sharing that. And I understand the result you have radial nerve palsy due to your fall, and that's something that's also common with a humerus fracture because your radial nerve sort of wraps around your humerus bone there.
Yeah, and that's why I can't lift my wrist up.
Yeah, so you have what you call wrist drop, and that happened because when you fell, you received some compression on your nerve, and that's what occurred with that radial nerve palsy.
So it doesn't go through the...
Exactly. We hope that you'll regain that function about 3 or 4 months. Sometimes it can take as long as 7, but we will introduce some splinting options for you today to help you kind of compensate for that.
Okay.
So are you right or left-handed?
Fortunately, I'm right-handed, but I am finding it really hard to do things around the house with just one hand.
Okay, well we'll definitely talk about some of those tasks and again, find ways to help you. So can I first see how you're wearing your sling here?
Yeah.
So I see that your wrist isn't supported here, and that really concerns me. So what I want you to do is try to put your elbow all the way back in the sling so it's supported like that.
Much better.
Perfect.
Yeah,
and the reason that's important is when your wrist is just hanging like this, these muscles on this backside are going to elongate, and these here are going to shorten. So we just want to make sure that our muscles are the appropriate length so that when we do get our nerve function back, we're ready to use them. Sound
That makes
good?
sense. Yeah, great.
All right, so let's...
OT is wonderful.
It is wonderful. So let's start by going over some of your precautions. What did your doctor tell you you can do? What did your doctor tell you you can't do?
He told me to wear this sling pretty much all the time. He also said I should ice it, so I've been doing that.
Yeah, and you ice it when you're in pain, I'm guessing?
Well, at first I iced it all the time just to help reduce the swelling, but now I do it occasionally when I'm in pain for about 20 minutes.
All right, and how often are you in pain, and how would you rate it on a scale of 0 to 10?
It occurs mostly when I'm dressing and bathing. It's about a 5 or a 6.
Okay. Well, it is good that your doctor said to wear the sling as often as possible. You want to wear the sling in active settings when you're out and about in a grocery store, just so that you don't bump it or get hurt. But when we're in a safe setting that you're in control in, maybe you're sitting at home or like in here in therapy, we actually want you to encourage being out of the sling. Okay. So go ahead and demonstrate how you would take the sling off for me. Okay. And we'll go ahead and start including it in therapy. Good. And I like how you're resting your arm just like this. So a precaution is you never want to lean on your elbow like this. You do want to lean on the forearm just like this, and that's going to promote some weight bearing up into the arm. and it provides sensory input, so there's just great benefits to weight bearing on your arm like this. So we're going to begin with our evaluation. So before any evaluation, you should monitor for pain and any edema before we begin. I want to check your range of motion in this arm, and we're going to be standing up. So let's slowly stand up. Tell me if you're dizzy or anything.
Okay. I'm feeling okay.
Okay, good. So what I'm going to be teaching you is an exercise called pendulums, and this is something I'm going to want you to do at home, and this is how I evaluate how well your arm is moving.
Okay.
So class, we're not going to go in too much depth as far as the pendulums go because we have learned this in adults, but you would want her to bear weight on a firm surface. This table would not be good because it would move. She would bend at the trunk, and Yolanda, go ahead. You want to sort of rock and get some momentum and let gravity do the work.
Mm-hmm.
So I would want you to do your arm front and back, and then also try to make little circles. So I tell my clients to maybe start with a golf ball or a ping pong ball, and as we progress with therapy, you would do maybe an orange and get bigger and bigger. One of her precautions is to not bring her arm out away from her body, so I'm not going to instruct her with abduction or adduction. Great, Yolanda,
Great.
Go ahead and have a seat for me.
All right.
So now I want to test your range of motion in your wrist here. So class, again, because she has the wrist drop, she wouldn't be able to extend her wrist in a gravity, against gravity, so you're going to be testing it gravity eliminated. So Yolanda, you would place your forearm in neutral here, and could you go ahead and bend your wrist towards this area? So over here. Yeah, so I see you're flexing great. Can you bend it over to this direction?
Nope.
All right, so she does not have any wrist extension on her own. So Yolanda, we want to keep our elbow, wrist, and our hand active so we can prevent contractures, reduce chances of edema, and of course help you getting back to using this hand functionally. So some of the exercises that she would take home include elbow flexion and extension. So with radial nerve palsy, the triceps are spared, so she would be able to do this. So this is one that you can instruct her with. Also wrist flexion and extension. And again, she could try to do it on a table here. Since she doesn't have active wrist extension, she's going to use her other arm as an active support. So she can do it on the table here, or she can do it above up here. And you would want to encourage both the wrist as well as the fingers. And Yolanda, I want you to do these about 10 times each. Let's start off with 3 times a day for now. So an easy way to incorporate that into your daily routine would be to doing it at meals. So breakfast, lunch, or dinner, or any snacks.
Okay,
Do you
great
have
tip.
any questions with this?
No, that sounds great.
Okay, perfect. And we'll switch roles here, but we are still doing our eval 2 weeks out.
Okay, Yolanda, so now we're going to go over a few different splinting options
Okay.
to support both your shoulder and your wrist and your hand.
Mm-hmm.
All right. So let's just see. And so in supporting that, we're going to make it easier for you to incorporate that left side into your activities while stabilizing those areas. Okay.
Perfect.
Okay. So I'm going to start with your shoulder. And the reason for that is that when we stabilize your trunk and your shoulder, it allows you to move your arm with more control.
That makes sense.
Yeah. So this is a circumferential Sarmiento brace. I recommend wearing this above a sling because it does a really good job of holding that shoulder in place while the bone heals. But it also exposes that arm so that you can use it every day.
Yeah, that's what I want.
Yeah, so it has nice soft Velcro. You can adjust it so it fits snug. And when you do that, also provide some compression to help with edema.
Perfect.
Swelling, that is. So then we would kind of demonstrate donning and doffing. All right, so moving on, let's take a look at how we can support that arm and wrist in a normal position. Just so I know I was clear, why is it important to maintain that normal position?
You mentioned something about my muscles lengthening, and so I just want to keep them their normal size.
Exactly. So when the function comes back, they have some
Elasticity?
There we go.
Yeah.
And you're ready to go. All right.
Okay.
So this is called a wrist cock-up splint. I'm going to put it on you. Pretend this is her left arm. And you can tell this stabilizes your wrist. It also brings it up a little bit, which has the effect of bringing your fingers into a functional position. Again, making it easier for you to incorporate it into your daily activities.
That's awesome.
Yeah, how does that feel?
Good.
Good. So I want you to wear this brace every night for sleep. And you can also wear it during bathing or during dressing, not bathing. And also when you want kind of a more obscure brace when you're out doing groceries in the community, that kind of thing.
Okay.
All right? Okay, great. So then we would return demonstrate how she dons and doffs that brace.
And again, this is a brace that's for the right hand, but we would have tested this on the left hand in a real scenario.
So, Yolanda, this is just a prefab brace. I recommend you getting one at the pharmacy. You can ask the pharmacist to help you get the right size for you.
Perfect.
Okay? So, this last splint is the radial nerve palsy splint, and it's designed specifically to help people with the
That's
challenges
what I
that
have.
you're having.
Yeah.
Exactly. So, as you can tell,
Wow, this is quite the splint.
yeah,
here.
it's a little more bulky, but it is pretty awesome. It both supports your wrist and, let's put it on here.
And this
There
is
we are.
this is a little big for me. This is just a sample, right?
Right,
Okay.
right, yeah.
Oh my gosh.
It supports your wrist. It also has these finger loops. Yeah, go ahead and put them on. So that you can straighten and bend your fingers when you are wearing the when you're wearing the brace.
Oh, that's cool.
Isn't that cool? Yeah, so, again, careful of your shoulder. Do you want to, I know, it's so exciting.
I know.
So, again, I want you to wear this brace as much as you can during the day. Not only does it help maintain that position for your tissues in your hand,
Mhm.
but by using your hand, it's going to quicken the recovery time and you'll get that function back quicker. Okay? And
Great.
it makes it easier for you to use.
Yeah, makes
Okay.
sense. This is awesome.
So another cool thing is you can do your range of motion exercises with your fingers with this on.
It's a little hard still.
Okay. Yeah. Well, it will get better the more you wear it as well.
Perfect.
Okay. So that's good. Next session we'll make one that fits specifically for you. Great. Okay. So now we're gonna talk about your daily activities
Yeah.
and see if there's ways we can make them easier to perform using some adaptive equipment. So Yolanda, tell me, what are some activities that you've had trouble completing since your fracture?
Obviously, like putting on a shirt, as you can imagine. Showering, I've just been concerned about falling again. And I haven't been able to do laundry or cook yet. My husband's been doing it, but that's definitely temporary. That's not his expertise.
Okay.
And you know what, it's also been painful sleeping.
Yeah.
And eating a little bit, my plate seems to run away from me, if that makes sense.
Absolutely.
Yeah.
Yeah. Okay. Great. So that's a lot we can work with. And how do you feel about starting with eating, bathing, dressing, and sleeping, and save the other activities for next session?
Yeah, that seems like a good priority. Those
Okay.
are things I need done.
Great. Okay, so let's start with eating. You can copy what I'm going to do here. I'm going to get up close to the table and lean your left arm on the surface of the table. Bring your hand up next to the plate so that you can support it while you're eating.
Oh.
How does that feel?
Good.
Yeah.
And I imagine this is how I could support my toothbrush when I brush my teeth.
Absolutely. I like your thinking. You can really apply this technique to
Or
like,
anything I gotta hold down.
holding your toothpaste, holding your insulin bottle when you're administering your
That's
medicine,
smart.
holding that vegetable when you're chopping it.
Perfect.
Yeah, and the more you do that, again, the better it's going to be. All right, so now we're going to talk about dressing. We're going to use a one-arm technique for this, kind of also with a pendulum swing idea. So the client's going to lean forward with a straight arm, and then dress that affected arm first. Yeah.
Same
Put
technique
it
that we
on.
learned in adult. So button-ups would be recommended, but if she had to use a normal shirt, then the leaning over technique. That's a great tip, thank you.
Yeah, absolutely. So let's do a simulated shower.
Okay.
I'm really glad, I think you brought up safety during showering. And I recommend you getting a shower seat to put in the shower so you can sit while you're showering. Not only will this help you be more secure in your balance, but it should also help you be able to reach the different body parts that you need to wash.
Okay.
All right? And I also recommend using a long-handled sponge like this to wash the different areas. Do you mind showing me how you do
Yeah.
that? Fantastic. Your back is a good place for that. Great. Another tip too is the pendulum, kind of what we did with the one-arm dressing, where you lean forward, bring your arm extended, and that exposes your armpit area so that you can wash it.
Yeah, and that's a good technique I could use to put on my deodorant under that arm.
Absolutely.
I can't say that I put deodorant on that armpit this morning.
Now you know how,
Yeah.
in a safe way. Absolutely. Great. So now, as far as sleeping, you know,
It's painful.
I bet it's uncomfortable. You gotta wear your sling, your brace. Now you have to wear, you know, a splint and everything.
Mhm.
But it is really important you maintain that position while the bone heals and the, you know, integrity of your tissues.
Is there anything I could do to be a little more comfortable?
Well, you want to sleep on your back, and put a small pillow under your arm.
Okay.
I'll also recommend putting a pillow under your knees to help reduce some strain in your back. If you do feel pain when you're sleeping, sleeping in a recliner chair is another way that clients find relieves pain. All right?
Perfect.
So that's what I have today, and I'm really glad you came. It sounds like you like the splint.
Yeah, so you gave me some great tips and
Great.
advice, and I'm excited to do
Great.
OT with you.
Well, me too. And next week we'll make that splint specifically for you and go over some of the cooking and other activities. Okay, great. Do you have any more questions?
I don't, thank you.
Thank you.
That concludes the presentation.